The Numinous Podcast with Carmen Spaniola.
Hi there, and welcome to the Numinous Podcast, where we have interesting conversations with everyday folks about the mystery of life. I'm your host, Carmen Spaniola, joining you from the lands of the Lekwungen-speaking peoples, the Songhees and the Esquimalt First Nations, recently known as Victoria, BC, Canada. My friends, I have been in the most amazing, life-changing class for the better part of this year. I should say it's not a class exactly, it's actually a telehealth group. In other words, a group of patients under the care of Dr.Kristin Schnurr. She's a naturopathic doctor who specializes in complex endocrine concerns, including perimenopause and menopause. So every month, we've been gathering for 90 minutes, and for the first half, Dr. Kristin gives an educational presentation on a particular aspect of the midlife transition. And then in the second half, we ask questions and she can make recommendations. And then later on, through one-to-one telephone or in-person appointments, she can order lab tests or write prescriptions as needed. And the topics have been quite varied. Of course, there's the things we expect: hot flashes, night sweats, lack of sleep, mood, the emotional changes, the physical changes. It's really a wonderful way to receive primary health care. It's genuinely as amazing as it sounds. Can you imagine having 90 minutes with your primary caregiver who is explaining everything to you in detail and with lots of data and charts? It's awesome. And I, of course, being me, I frequently show up to our monthly Zoom calls, in my pajamas with cowlicks in my hair, yesterday's makeup. So it's so awesome. I don't even have to leave the house to get primary health care. I take copious notes through the presentation. And then afterwards, again, because I am fairly unburdened by social norms around propriety, I get really excited about asking super specific, sometimes very personal questions about stuff like, how can I find out if my preferred brand of lube is thinning my vaginal membranes, Dr. Kristin? And she, with her soft voice and gentle, calming demeanor, is always there with data and empathy, experience, knowledge, know-how. So of course I needed to invite Dr. Kristin onto the show so I could shout from the rooftops some of the most surprising things I've learned about perimenopause and postmenopause through this year of telehealth. Folks who've listened to this show before, for a while, they know that I've been in perimenopause for a while now. I've talked about it with at least 8 guests that I can remember in the past few years. And I'll list those episodes in the show notes if you're looking for a perimenopause playlist for the Numinous Podcast. But this is the first episode where we make it the main topic of conversation. And I want to preface this by saying, we do refer, I think, in this conversation to women's health at times, but we are speaking to everyone who menstruates. And it has been great to hear Dr. Kristin share information in our telehealth group for folks with lots of different kinds of hormonal histories and also lots of different social locations. So, maybe this topic does impact you even though you've never menstruated. Some of the things I've learned about the intensity of Black women's symptoms during perimenopause have been stunning, yet not surprising, of course, given what we know about the traumatic impacts of white supremacy culture on health outcomes, etc. All that to say, we're trying to open the big tent here. So you might not menstruate, but perhaps you love someone who does, or perhaps you have complex endocrine challenges. I bet 99.99% of listeners are going to learn something today. And then stay tuned to the end of the show when I share more about how you can be part of Dr. Kristin's class, either as a group telehealth patient, or if you're outside of BC, you could participate in her self-paced online course coming soon. Also, I'll tell you about how you can ask Dr. Kristin your own questions live in our monthly Perimeno AMAs, Ask Me Anythings, which happen in the Numinous Network. So stay tuned to the end for more details on that. But for now, without further ado, meet Dr. Kristin Schnurr. So, Kristin, what identities do you lead with?
I love this question. I love thinking about the evolution of our identities throughout our lifetime. I am a cisgendered, white menopausal woman of mixed European ancestry, so English, Irish, French, and German. I'm a mother, a partner, deeply curious, super sensitive person, very interested in humans, the inner workings, both the tangible and intangible aspects of those inner workings. I try to be a compassionate truth teller, insatiable learner in my work as a naturopathic physician. My clinical focus would be on neuroendocrine health, so the intersection of the endocrine system and the nervous system. And I work on a small little farm as a side gig as a farmer, and I'm really strongly connected to the natural world in lots of different ways. Yeah.
I would love to hear more about your nature girl side. What are some of the, or maybe one of the most formative experiences you've had in the outdoors then?
I don't know if I can come up with a most formative. I have been outside for my whole life. When I think about my childhood, I was out there building and exploring, just gone, child of the early 80s. So left the house in the morning and came back after dinner or for dinner. So it has been a part of me for as long as I can remember. I think I was and am deeply feeling and very sensitive. And I think at that time, I unconsciously used being outside and moving outside as a way of regulating. And I still do that more consciously now. So I think, time spent in the forest or on trails or in wild, beautiful places. It's how I integrate, process, clear, connect with myself more deeply, I think. So it's deeply regulating for me. It's an anchor, and it's really important for me to have that as actually part of almost every day. It's very hard for me to go into big cities for extended periods of time where I don't have access to a beautiful wild place.
What kind of farmer are you? Like, are you farming in a subsistence way just for your family, or do you sell your wares? Are you like a little market farmer or bigger?
We are a very small market farmers, I would say. We both have full-time jobs and we farm on the side, but I think we grow quite a bit of food, even in that sort of part-time capacity. So we have lots of veggies and a small orchard with apples and pears and blueberries. And we have 13 chickens right now. And we actually had meat birds this year for the first time. We raised meat birds, so that was new learning. And we sell microgreens to a few local restaurants and markets. And we also sell butternut squash and carrots.
The foodie in me loves it. Oh, that's so great. Okay, so we're here today to talk about the perimenopausal transition. This has been up for me for a few years, but I just kept thinking, I'm probably not really in perimenopause yet. I don't know why. I'm 48 now, so I don't know why I didn't think I was, but I think I had in my mind 50, and that, menopause happened and then the worst came, the worst parts of it, or the biggest changes, the most obvious, and the most obvious sign would be my cycle. And so since my cycle has been so irregular for so long, I sort of thought, well, I don't know. I guess this is just how it goes. But as I get closer, maybe in the year before, it'll start happening less and less. But because it was happening sometimes more and more, I just missed it. So please give us a brief definition, or not a brief, whatever, however long a definition you want, but define for us, what is perimenopause and what is menopause?
Okay, well, first, I just want to validate that your experience is super common. I think many people have in their minds, many even healthcare practitioners, clinicians have thought that things really get intensified at menopause, but the truth is that perimenopause is for most people the most turbulent time, and it seems to catch most people off guard when it starts. So perimenopause, it's a naturally occurring aging event, and it marks the transition from your reproductive life stage to your menopause, to the last menstrual period. And it can last 4 to 15 years. And
4 to 15. My friends, we have to pause right there. 4 to 15 years it can last. Like that's a pretty stunning range. And well, I'm sure we'll get into it later about how it seems to line up about a quarter. Some people are going to be on the lower end, some are, half or kind of in the middle, and about a quarter at the longer end. 4 to 15 years. It's just, that's just like the first mind-blowing thing about it. Okay. Sorry to interrupt. Carry on.
And that is just the perimenopausal component, right? Then we add on the postmenopausal component, which, has its own trajectory as well. So yeah, it's not nothing.
Yeah, not nothing.
Menopause is kind of a retrospective diagnosis. So it marks the end of our reproductive life stage, but we don't know that we have reached menopause until we haven't had a period for 12 months. And so once we haven't menstruated for 12 months, we can look back to the day of our last menstrual period, and we can recognize that on that day, we reached menopause. And then everything after that is our postmenopausal life stage.
Right. So menopause is the one day that is 1 year after your last period. And then you're postmenopausal. So when we're like, oh, I'm in menopause, that's actually kind of a nebulous languaging, isn't it? It's not actually like medically correct. You're perimenopausal, menopause is 1 day, then you're postmenopausal.
Exactly.
I think we've just already elevated the level of common knowledge for listeners. For many, I would say many people, if not most, don't realize that. I did not know this until a couple years ago, maybe. And I don't even think I let that sink in until I became a member of your year-long telehealth group, which we'll talk about at the end. Okay, what do you say to your clients who say, oh, well, this is what happened for my mom and my grandma or whatever. This is what my mom's menopausal experience was like. And so I'm kind of bracing myself for that for me. Or they kind of think whatever their mother's perimenopause stage was like, that they expect that's going to be like that for them. And maybe they have concerns, or maybe it's, they have an idea of what it should be like. How do you talk to them then about tracking their own experience?
Well, this is also really common. So many people think that their mother's experience is going to really line up with theirs, and they are either, bracing or not bracing based on what their mother experienced. And then, of course, some people don't even know what their mother experienced. And I think many of our mothers don't even know what they experienced, because at that time, perimenopause wasn't even recognized. They were being gaslit like crazy and told that, what they were experiencing was a mental health issue, because, they were still menstruating and they hadn't reached menopause yet. So yeah, I have lots of thoughts, but probably what I would share clinically is that what your mother experienced could roughly predict when you might experience menopause. So the timing kind of roughly correlates, but again, I think it's about 40% of the time the timing correlates. So not a super close correlation. And then there's just so many other factors that impact timing. So and symptom experience. So we've got genetics, lifestyle factors, your personal health history. So the strongest predictive link is around timing, and even that is only about 40% of the time. There is a stronger link if your mother has experienced premature menopause. So menopause before age 40, there's a stronger link there. And it's even stronger if you've had multiple women in your family. So grandmother, mother, sisters, aunts who have experienced early menopause, then that would be something that you might be more likely to expect would happen. But the symptom experience really doesn't correlate, according to the research, very well at all, because there's just so many factors that impact the symptom experience for people.
This is so good to know, because I hear this all the time from women and people in the network, because we have our perimeno jams where whether you're perimenopausal or postmenopausal, all are welcome. And we just jam about this stuff. And so many people are like, yeah, then my mom had this experience. And as soon as I sort of hear that, I think, oh, I wish they were in Kristin's classes because that's a myth. That's a myth. It might line up, but like you said, it's not even the majority of the time. So why did the perimenopausal transition become a focal point in your naturopathy practice?
Great question. So my background is in endocrinology and probably more specifically neuroendocrine health. So the interrelationship between complex endocrine concerns and the nervous system.
And endocrine means hormones.
Endocrine means hormones. Yeah. The connection between glands and hormones and that communication. It's amazing and complex. It's super interesting. And that area is also really strongly correlated with autoimmune conditions. There's also quite a strong correlation with trauma history and onset of autoimmune or endocrine or nervous system issues. So I was seeing many people with hormonal concerns, many women with hormonal concerns, and that was showing up in their reproductive years. It was showing up postpartum. It was showing up perimenopausally and postmenopausally. And I would say on the whole, everyone was struggling and not feeling supported within the conventional system. And I think that's probably a theme as an integrative practitioner. Women's health is under-supported in general, and then midlife women's health is even more so under-supported. And then I think from a naturopathic perspective, we're really focusing on prevention. We're trying to be proactive. There's a real education focus. And I don't really think there's time for that within the conventional system. And so it becomes a bit more reactive in terms of supports. And so symptoms that are, not a pathology aren't going to get a lot of attention. So I started to do additional training in BC. Where I live, we got prescribing rights in 2009. And I started doing additional training in this area beginning in 2010 because I wanted to better understand and support my patients. And then because with complex endocrine issues and autoimmune stuff, it strongly correlates with earlier onset of perimenopause and menopause. And so I started to see more and more women who were meeting the diagnostic criteria for premature ovarian insufficiency. And if you think women who experience perimenopause are gaslit within the system, then you should talk to women who experience it early and are in their 30s, because just many people don't even know what they're looking at. And these people were really struggling and they were in need of support and they needed more lab tests. and sometimes prescriptions or just more support from specialists. So I was writing a ton of letters and advocating for support. And in many cases, the letters were just being ignored and these women weren't getting support. And in some cases, they were being given misinformation and, just basically being told that there was no way, they were too young. So that was frustrating for them. And it was really frustrating for me. And I feel like I channeled that anger into trying to make a change. And I decided to achieve the designation, which was at that time called the North American Menopause Society NOMS designation. And now they're called the Menopause Society. And I decided to receive certification with them because it's, a globally recognized designation. And I thought it would help my patients get better care if I signed off on a letter with a designation that had sort of more recognition.
Mm-hmm.
And it's made a big difference for patients. And in terms of accessing interprofessional care, it's made a big difference, which has been great. And then in getting that extra training, it just, I think my patients would tell their friends or colleagues. And so it just more and more people started to seek support in that area. And I feel like there are lots of naturopaths who have the tools. There's more now that have that designation, but at the time I was one of very few that had the designation. And so, that's, I guess, how I sort of shifted my practice in that direction.
How about your own personal experience of becoming menopausal?
Well, my own personal experience kind of mirrored what was happening for my patients, and that, it caught me by surprise. It was sort of earlier than I expected. I was postpartum when I started to have symptoms, and I have lots of great care providers, and none of them, and even me, were thinking that that's what was going on. So we were all sort of interpreting it as like a postpartum hormone insufficiency that would, correct itself.
What kind of
And
symptoms did you have? Like that were like, oh, this is more than postpartum.
mhm. Well, I was having hot flashes at night, breastfeeding and having hot flashes.
Oh my God.
And I would say some mood stuff was there that was different than my, previous postpartum experience. I would say the primary symptom at that time was probably vasomotor symptoms, and then some genitourinary symptoms as well, which is super common in the postpartum group of women, but it should correct in a few months and definitely should correct with treatment. But I would say that diagnosis was missed. And then, my cycle wasn't coming back. And again, that was, it will come back, you're still breastfeeding, it will come back. And it did come back, but it never returned to a monthly regular cycle like I had before having my daughter.
Mm. So even with all the knowledge and being able to probably have better knowledge of what a right fit or good fit is, just sourcing care providers, you had a high level of knowledge, self-knowledge, and industry knowledge. And even then it's it'll probably even out. It'll probably be okay. For folks who heard that term kind of slide in but aren't familiar with it, vasomotor symptoms is essentially hot flashes, right?
Yes. Sorry. Please correct me.
No, that's great. And
Terminology.
Was that?
Correct my terminology if I'm saying things that are more medical. I'll try not to.
No, I think it's great. Well, vasomotor symptoms, that is more what it is, because not everybody experiences it like a flash, as they say,
Exactly. Yeah.
Mine actually, I've only had, I don't know, maybe 7 hot vasomotor symptoms. And they are almost exactly like when I was 14 and I started to develop allergies, with the primary symptom was hives. And I could feel the heat come up my body. And then I would have these like large red itchy patches that were like a raised plateau of skin. So imagine my surprise, Kristen, when I was like, I am suddenly on fire. It's rising from my groin, front and back, and I am itchy all over my body. And I'm like taking antihistamines and all this stuff, because the problem is that kind of vasomotor symptom creates kind of a domino effect where it's like, now my histamine, like I am inflamed. So hot flash is not what I would have called it. I would have been like, I am having an allergic reaction to my body. So yeah, vasomotor symptom is, I think, a little bit, it may sound technical, but it is less, I think, diminishing of what the actual experience might be for some women.
Yes, agreed. Very true. It is, I would say there is, huge variation, right? It can be seconds to 10 minutes, and it can be like profuse sweating, drenching your clothes, to like, not sweating at all. People can feel panicky before or around a hot flash or that vasomotor symptom. So yeah, there's a huge range. And I think if we don't understand that there is a huge range, we can miss that what we're experiencing might be related to a hormonal fluctuation.
Totally. Okay, let's get into some statistics, because there's like a few that have popped into my mind. So first of all, I remember you talking about, okay, like here's how we decide if a person is having a lot of vasomotor symptoms or maybe just fewer. So like what we can expect. And you said like, so if a person is at the high range of frequency of vasomotor symptoms, so hot flashes in a day, if a person were to guess right now, like I asked my husband, I was like, guess, just guess, what's the number at the upper range? And are you tracking the statistic? Do you want to share with the listeners this range of frequency?
Yeah, well,
That's
it can
normal.
be 1 to 2 a day, all the way up to like 24, 25 to 50 a day.
50 a day can happen, friends, listeners. It's like that is that's such a focusing event. You can't work, you can't function, you can't be on time for things. Okay, let's go to the basics here. So 49% of Canadian women are over 40. 95% of women have their last period between 45 and 55 years old. And 20% of women are firmly in perimenopause by the age of 40. 20%. That is a huge portion of women already by 40 are firmly in their perimenopausal transition. I don't think even 20% of women know that.
Yeah, well, I didn't know
No.
that. And I think that, for 20% of women to be firmly perimenopausal at 40, they had to have been symptomatic in their 30s, well before probably they were expecting it or looking out for it, or their practitioners were looking out for it.
Mm-hmm. And so they're getting prescriptions for other things. Like, in the 70s, maybe it was Valium because they're not feeling good and they're anxious, or there's what was the one you said to me with the urgency of escape was what it was when my progesterone was dropping. You're like, so that urgency of escape. I was like, yes, I want to leave my life that I love, but I need space, like thousands of miles of space. So they would have had these things and maybe been prescribed SSRIs or like other things. And I'm not saying those things are bad. I'm just saying that, but what if you could prescribe the thing that is actually, getting out of whack here? And that could be potentially hormones. Anyway, we'll talk about that in a moment. The other statistic I wanted to mention was one you just shared in our last class. And that was about the amount of funding that goes to research for women's health issues. Do you know the statistic? Do you remember this? It's 8%, you said. 8% of research, medical research in any given year is going to women's health issues, which is including all of our health issues, not just perimenopause. Okay. So what you shared about something called the straw classification of women's reproductive lives, that was a shock to me, real game changer. I had never heard of this. I was happy to have heard of it. But the straw classification is specifically these recommendations for, it's like a classification system for people who menstruate and their caregivers, their medical caregivers, helps them understand what stage the patient is in their reproductive life. So like, in other words, where are you in this bigger arc of your perimenopausal transition? How can we figure that out? Those guidelines, that was initially developed in 2001 and then kind of ratified again, or like updated in 2011. So like, literally we could say the entire medical profession is going off information that's like 10, 20 years old around this universally experienced stage of life for people who menstruate. I was absolutely stunned by this. So can you tell people, like, give us an update on like the sort of what we say in Canada, the Canadian classification for how you know when you're in perimenopause, and like, are you early in that process or late? Tell us about this.
Okay. So the STRAW criteria, it stands for the Stages of Reproductive Aging Workshop. And it was a huge deal because it was one of the largest studies at that time. And it was a meeting, a workshop involving experts from 5 different countries, looking at the review of data and information from the largest cohort studies we had at that time on midlife women. And they wanted to standardize the baseline staging system so that it would make clinical decision-making easier. And it would also sort of create like a standardization for research as well. So we could classify people as, early in the perimenopause transition versus late in the perimenopause transition. And I would say, it began in 2001, but it wasn't until they met again in 2011, and then I think actually published the beginning of 2012, that it really became useful and as useful as it is now. So it's like 11 or 12 years old, which is why I often say, like, our parents, our mom, like, they didn't even know they were perimenopausal because that wasn't even a thing. I mean, I'm sure they knew, but no one was listening to them.
And if your doctor just graduated in the last 10 or let's say even 20 years, they don't, and if they graduated from medical school earlier than that, they have no freaking idea how to classify you.
Exactly. Yeah. So the STRAW criteria broke the reproductive and post-reproductive life stage into 7 stages. So there's, stop me if you want less detail. So there's 5.
No, we love it. Give it to us.
Premenopausal stages. So there's the reproductive stage, which is divided into early, peak reproductive, and late reproductive. And then there's the perimenopausal phase, which is divided into early and late. Then there's menopause, and then there's early postmenopause and late postmenopause. So should I tell you about each stage? Okay.
We're curious. Yes.
So one of the things that I find most interesting is that in the late reproductive life stage, this is often quite a symptomatic period of time for women. So as we were saying, at 40s, 20% of women are firmly perimenopausal, but they were likely symptomatic before that. And in that late reproductive stage, they're still menstruating very regularly. There may be slight fluctuation in cycle length. So if they consistently have a 28-day cycle, they might have a 27-day cycle or a 26 or a 30-day cycle, but just a little bit of variation. And they're still consistently getting a period every month. So if we were to try to measure hormonal changes, we probably wouldn't see much change in terms of lab work, but they are probably feeling pretty symptomatic in many cases. And then early perimenopause is when we see an increase in symptoms. The cycle is still coming pretty consistently, but at this time we start to see changes of 7 or more days in terms of a cycle length. So someone might get a period that is a 21-day cycle, and they menstruate. And if that happens twice in that year, we are pretty confident they're in that early perimenopause stage.
Oh my God. So this was me certainly 8 years ago. No idea this should have been on my mind.
This was me before I had my second child, but I didn't realize, I thought, oh yeah, it's normal for cycles to shorten, but I wouldn't have said, I'm in early perimenopause right now.
Right. It's normal for cycles to shorten. And also I'm super fatigued. And also I want to burn down the patriarchy. And also I'm having like relational troubles. And also I'm feeling more anxiety than I used to. And, because we have so many environmental causes that we're like, it's probably just stress, which of course life under capitalist imperialist white patriarchy, all of that does make sense. But when we start to see it in our cycle, we could start to maybe also consider that there's physiological changes we need to be tracking too. Anyway, sorry to interrupt. Carry on.
No, that's helpful. And it's helpful to for sure have the changes in cycle length, because it's just a more objective marker. Mm-hmm. And then late perimenopause, symptoms are increasing even more at this stage. And now there will be a missed cycle. So someone will go 60 days or more without a period. And if that happens twice over 10 months, we say they're in late perimenopause. So if it happens once in a year, we know they're getting closer, but they're not quite in late perimenopause. And this phase, we think for most people lasts 1 to 3 years, this late perimenopause phase. It's harder to quantify the late reproductive and early perimenopause because the timing varies quite a bit. And then we have menopause, which we've already defined. And then early postmenopause is the first 5 years after your last menstrual period. So you haven't had a period for up to 5 years. And at this point, we start to see consistently elevated FSH. It was creeping up in perimenopause. In late perimenopause, it's up, but it may not always be up. If someone has a period, it might normalize.
What's FSH?
FSH stands for follicle stimulating hormone, and it's a pituitary hormone that is communicating with your ovary and asking for an increase in estrogen. So when
help you. That's what FSH is.
So when FSH goes up, it's kind of like your brain is yelling at your ovary. It's getting louder. It's like, come on, I need more estrogen. And so it's harder for our ovary to produce estrogen at that stage in our lives. And so our brain is trying really desperately to balance everything out, and it's producing more and more FSH. Mm-hmm. And eventually, our ovary just can't make estrogen anymore. Mm-hmm. And FSH just stays high and it's nice and stable. But in that late perimenopause, it's going to come up. It might successfully induce ovulation, and we might have normal estrogen levels or low normal estrogen levels. But once we stop menstruating, that FSH stays really high. And in late postmenopause, our estrogen levels stabilize as super low as well. And late postmenopause is from 5 years after our last menstrual period until the end of our life.
Right. Okay, so that's kind of like how people could kind of get a general sense of like, where are they in this transition? If they are anywhere from their 30s to their 50s, let's say, there's something up for them probably.
Mhm.
And one of the things that has really come home for me that I just don't think I really took seriously or I didn't internalize for so much of my life was how crucial and central hormones are in the functioning of every system in the body. Everything, everything, everything. I even think about, I came from a family of like chronic dieters, lots of diet culture. And now looking back, it's like, it's not about what you're eating, it's about your hormones. Like, they're so that has been absolutely eye-opening for me and very helpful. And so to have a map of like, okay, how far along am I in this has been helpful for me to go, okay, should I be looking at medication? Should I be looking at things that could help boost my hormones? Because here I am at this stage, and we know that actually it's more effective for me to be getting hormone enhancement earlier than later in my transition, right? What would you feel comfortable saying? This is not medical advice, everyone, but what would you feel comfortable saying then about once a person identifies, here's where I am in the process, should I be looking potentially at menopausal hormone therapy? What would you say to them in terms of where they are in their process and decisions they might want to make about that or explore?
Mhm. Well, what is true for most people is that the perimenopausal transition is a more turbulent time because we're having greater fluctuations and more variability in hormone levels. And so, for most people, the early and late perimenopausal period of their life is more tumultuous. Symptoms are more intense, more variable. It can be a harder time. There are many things that we can do to kind of smooth this out and help with our sort of body's inflammatory response in a way to the hormonal fluctuations. But I think that everybody should have a conversation with someone who understands menopausal hormone therapy. I think it should be something that you are informed about, and it could be part of your decision making process. It's something you could consider. The pros and cons need to be weighed individually. It's definitely not for everybody, but I think for so long it was kind of off the table for women in general, and even until really recently for perimenopausal women. So many people have been hearing for even the last 5 years that, oh no, you don't do that until you stop menstruating. But what we actually know based on the research is that there can be significant benefits for some people in starting it earlier because it is a really turbulent time.
Right. And so when you're talking about early and late reproductive period, just so people know, that's like adolescence, getting your period, and then starting to have that taper off. What I noticed for me at adolescence was the onset of mysterious and like incredible allergies and hives and inflammation. And of course, it was like, oh, it's probably stress or it's probably whatever, but there is a hormone link. And of course, what I know now is a huge histamine response like that is considered an autoimmune response. And so when you were saying earlier about like there's a lot of correlation between autoimmune disorder and trauma histories, hormonal imbalance, like all of these things are interplaying together. So I think that's really important for people to recognize. One of the things that I also did in my adolescence was on Depo-Provera, was on the pill, was on these other kinds of contraceptives that had higher doses of hormones than what is even recommended for most women in perimenopause, right? So for people who are kind of scared of that, like, oh, like we're scared of cancer, we're scared of these other things, I just want everyone to know. So the research is updated and we know so much more now, and we don't have to be afraid of it. You, in your course, the year-long telehealth course, and then soon, we'll talk about this at the end, but your self-paced course, have two parts. It's two whole sessions on understanding why there's been so much fear around hormone therapies and what the current research is. So I'm super happy about that. How does this classification system, the straw classification, and like even our standards of treatment for perimenopausal and menopausal women compare in Canada to other places in the world? Because I hear from people I know who are in the UK, who are in Ireland, who are like, oh, we think of it differently. We do different things. Our mammogram frequency is different. What would you want to say about how our system is in Canada versus other places?
Well, it's not standardized globally. We don't even standardize healthcare province to province, right? So, what we do in Alberta is different than what we do in Ontario, et cetera. So we definitely do things differently. In the US, they are standardized between states. And I would say, to generalize, in the UK, in Australia, Europe in general, more progressive. Even in the US, I would say more progressive, probably because of the larger menopause societies. So the North American Menopause Society, which is now called the Menopause Society, is based in the US, and the International Menopause Society, the British Menopause Society, they're larger and more robust. And I think that has been driving more updates to standard of care. So, we all have access to this research, but I won't say necessarily as a naturopath, because we don't have the same standard of care guidelines as a family physician would. But, if a standard of care guideline was last updated in 2010, that's what clinicians are making decisions based on, unless they've done independent research or unless they're a member of a society that is showing them updated guidelines. And so, yeah, I would say Canada has been, I would say, a little bit behind other countries for sure.
Mm. So we really do have to take a very proactive stance, I would say. If we feel like we have persistent symptoms, or we're like, oh, my malaise isn't going away. I don't think my SSRIs are working as much. It turns out I'm turning 40, it's like, okay, well, you may need to be awfully proactive with your GP and like potentially find a naturopath who has additional training, because even your naturopath may not know how to track those kinds of endocrine issues.
Yeah. And the societies, I would say, like the International Menopause Society and the Menopause Society, they have great guidelines and they have patient information. So it's not all sort of medical lingo, high level research based data. Like there's lots of things that are very accessible, and those can be, you can read them, you can share them with your doctor. I would say, there has been, many physicians use UpToDate, which is a medical database, and there's been updates in UpToDate recently, which should help people get better access to care.
That's great.
I would like to add just one thing that we should follow up on from the straw criteria. So it wouldn't apply to someone if they've had a hysterectomy, if they're using a birth control pill or have an IUD, or if you have a diagnosis of PCOS.
Polycystic ovarian syndrome.
Yes, thank you. Or if you experience premature ovarian insufficiency, so the cessation of your menstrual period before age 40.
Okay.
It doesn't apply to that. And then the other piece to just follow up on diagnosis is it's really a clinical diagnosis. So you have to take a good history. You have to really listen to people, spend time listening to what's happening with their cycle, what their symptoms are, the breadth of their symptom experience and how that may correlate with their cycle. And then we do measure in serum, so basic blood work, we would measure FSH, which we talked about, as someone progresses. And then we might do more testing if someone was very symptomatic under the age of 45. But usually for people who are 45 or older, we really are just making the diagnosis based on their clinical presentation and symptoms.
Like an interview. It's not going to be peeing on a stick or taking blood necessarily. It's that you need to have that spaciousness with your medical provider. Yeah.
Mhm.
Okay.
And it can be really helpful to, you know, bring a list of your symptoms in and just have that information ready to present it as well.
Yeah, for sure. Well, I will definitely make sure we put links to the societies and those resources for self-advocacy in the show notes. I was also struck by one little factoid you shared about the ACE studies and vasomotor symptoms. So, for folks who are maybe not familiar with my work in terms of what I teach in the Numinous Network, in my course, Secure, the Magical Art and Subtle Science of Attachment, there's a whole section where I talk about the ACE studies, which stands for Adverse Childhood Experiences. And this was work that was co-led by Dr. Vincent Felitti, and who I just like adore. I've watched hours and hours of YouTube of him. And yes, there are some problems with the ACE studies. They like arose out of the insurance industry, Kaiser Permanente, but it was like this massive data set that they were able to get because they were trying to help their clients who were struggling with their weight. And in spite of all that, I would still say, yes, there are problems with the ACE studies. However, the additional research that has come out of that has been phenomenal. And Vincent Felitti, who was looking at the data, was able to move beyond the insurance company's goals of like, how do we get these people to stop, like maybe they get surgery or, laparoscopic surgery, and then they gain the weight. How do we reduce that? Well, Vincent Felitti was like, oh, trauma is the cause of all of these adverse health outcomes. So I'll put a link to the ACE questionnaire in the show notes as well. It's just questions, 10 questions. And one of the interesting things about the ACE studies is that just being asked the questions, not having any treatment referred to them, but just being asked the questions, reduced the number of doctor visits in the next year by 30%. People literally just felt better being asked, what happened to you in your life before you were 18? So it is worthwhile just kind of knowing what's your ACE score, and also no stigma here. Like, I'm an 8 and I turned out fine. So it'll be okay. But one of the things that you shared in your course, Kristin, and I think it was Dr. Rebecca Thurston's research, correct me if I'm wrong, but it was that if you even just have an ACE score of just 2, which is essentially there's like 2 kind of, negative, let's say they have a negative valence, 2 rough things that happened to you before you were 18. Could be like divorce, or could be, a family member getting incarcerated. There's like these, but it's like out of 10, these 2 things happened. You were 70% more likely to report debilitating vasomotor symptoms, hot flashes, just with an ACE score of 2. 70% more likely to have debilitating hot flashes. So can you tell us, what is the connection between ACE scores and vasomotor symptoms? This will be more interesting for people if they know what their ACE score is, but 2 is very, very low, I would say. Go ahead.
Yeah, many people, I would say, could have an ACE score of 2. So Dr. Rebecca Thurston is a researcher in Pittsburgh, and she has a focus on midlife women's health, and specifically looking at cardiovascular disease and dementia. But she also has done a lot of work looking at the link between trauma and increased risk of cardiovascular disease. And so, yes, this stat came from her work. It also came from the work of Dr. Etka Kapoor, who's an endocrinologist. And she led a study that examined the link between menopausal symptoms and ACE scores, and saw that there was a strong association, even after they controlled for other factors, in terms of self-reported intensity of symptoms, longer duration of symptoms. And then once the ACE score became 4 or more, intensified a lot. So there's already a well-established link between adverse childhood experiences and long-term health outcomes. So substance abuse, eating disorders, autoimmune conditions, diabetes, cardiovascular disease. And there's been some previous research that linked a higher likelihood of a bilateral oophorectomy, so removal of both ovaries early in women who had a higher ACE score, which I think is very interesting. So presumably they had ovarian symptoms, or potentially they had extreme intense symptoms and they were trying to regulate. So we don't totally know why this is happening, but we have some idea. So intense vasomotor symptoms are definitely related to fluctuating hormones and an inflammatory response. So that change in hormones, fluctuating levels of estrogen, activates the nervous system. And that shift in estrogen in midlife impacts our ability to thermoregulate, so balance our temperature. And one of the ways we thermoregulate is we dilate and constrict our vessels, so our blood vessels against our skin, and then we, sweat to cool off. And I think this is just very connected to the nervous system response and a historical trauma stress response. So people are having an amplified response if they have that history. I think we're going to talk about this a little bit later on, but there are also links with depression incidents around perimenopause and an ACE score, a higher ACE score, or even an ACE score of 2 or higher as well. So yeah, I hope that was helpful.
Totally. And we also know, so ACE scores don't filter for marginalized identity. So can you share for listeners who are people of color? There is some data that like Black women in particular have much more intense perimenopausal symptoms. Is that right?
That is true. Black women, Hispanic women have greater symptoms, higher intensity, severity of symptoms. And that's really important for us to acknowledge because they may be missing out on care in terms of timing of their reporting. I should say that study that was done by Dr. Ekha Kapoor was one of the criticisms was that it was mostly white females with post-secondary education. So again, like we're missing a huge portion of the population.
Absolutely. So yeah, let's talk about the connection between hormones and depression and anxiety. So one of the things, this is again, mind blowing. Every single class, I take tons of notes and I write down all these statistics and then I go immediately to the perimenopause jam and go like, oh my God, you guys. I tell my husband first and then I tell every other person. So you shared that even if you've never had a major depressive episode before in your life, you are 4 times more likely to experience one during your perimenopausal transition. You've never had a history, anxiety, depression, never had a major depressive episode, but 4 times more chance you're going to experience it now. And if you have had a major depressive episode, and I just want everybody who has, just like right now, feel your feet, feel your seat. It's going to be okay. We've got you. We see you. Here's the number. You're 13 times more likely to have another one now in your perimenopausal transition. So why does this happen, Kristin?
Well, we don't 100% know why, but we have some things that we think might be causing this based on what we currently know. So we know that there is a higher risk of depression in perimenopause, whether there's been a history or not, and that it's an even higher risk, as you stated, if there has been a history of depression. And we also know that if you have an ACE score of 2 or higher, then you are at an increased risk of perimenopausal depression, even if you haven't had a historical incidence. So we have estrogen receptors all over our body and throughout different areas of our brain. And we know that estrogen influences neurotransmitters like serotonin, noradrenaline, dopamine. We also know that estrogen influences something called BDNF, which is brain-derived neurotrophic factor, and it is neuroprotective, and it decreases inflammation in the brain. It gives us sort of more flexibility and adaptability in terms of our nervous system response. So in perimenopause, hormones are changing. We're losing our rhythm, which is inherently destabilizing. Estrogen levels are going up and down. We might not be ovulating every cycle, so our progesterone levels are shifting as well. And now our brain is more inflamed because we're making less BDNF. We also have more systemic inflammation because these estrogen receptors are all over our body. And our stress response is impacted, so that communication between our hypothalamus, our pituitary, and our adrenals is impacted. Our communication between our hypothalamus, pituitary, and our ovaries is impacted. We have lots of research that classifies perimenopause as a neurological transition state and also a systemic inflammatory state.
Wow.
So then we layer in like cumulative individual factors, genetics, a history of adverse childhood experiences, possibly personal history of mood changes that may have correlated with hormonal transitions, puberty, postpartum. Maybe there's ongoing and current stress related to just life, the world, patriarchy, our health. We're not sleeping. We might be experiencing vasomotor symptoms. We might be caregiving not only children, but also parents or community members. And we just don't have as much ability to regulate. And so those are all things that contribute. And then we also know that some women are increasingly sensitive to hormone fluctuations. So this might be women who have severe emotional symptoms in the late part of their cycle. So before they start to menstruate, this might look like someone who has a history of postpartum depression or anxiety. And we also know that some women are going to be more sensitive to these hormonal fluctuations in perimenopause. Mm-hmm. There is an amazing researcher, actually, who is Canadian, based at the University of Regina, Dr. Jennifer Gordon, and she's on a mission to really investigate the link between estradiol levels and depression. And what her work is showing is that a certain percentage of women are reactive to high estrogen. Some women are more reactive to when estrogen levels are low. Some women react to just fluctuations in general, and then some fortunate women don't seem to react to the fluctuations at all. And that is, I think, a huge part of why this perimenopausal transition, it just varies in terms of what our individual experience will be.
Totally. And this is why we need good attuned hormone support with a good attuned practitioner. And it's not a one and done. It's not like, oh, I just got on some hormone therapy or whatever. It's like, no. And now we're going to track it and we're going to see how it goes. We're going to keep tweaking it. And for listeners who listened to the mini series I did with my husband, Ruben, on Portrait of a Marriage, and episode 4, Ruben was like, I feel like I want to bring up that in our arguments, there were certain times when I could tell I just could not reach you. And what we know now is the hormone fluctuation and perimenopause and these things were like not named. And he's like, there's like the fights. I mean, we've always, okay, this podcast is rated explicit, so I'm just going to say it. We've always been an eat, drink, fight kind of couple. Okay. I said it very quietly. So sometimes the arguments could get very intense, but he would say there would be some times where the rage was like I just knew I couldn't talk to you. You were just in this like whirling dervish Tasmanian devil kind of rage. And I was like, oh yeah, I know that one where it's just, and so I don't know if it's just that. So the estrogen, which is like the hormone that makes you more palatable to society, it makes you nicer, gives you a better mood. I don't know if that helps me to calm myself down or what it is, but there would be something at some point in my cycle, and he would have to go, I bet she's going to get her period in a little bit. And what do you know? It would be the next day or 2 days later. And so this was why tracking, not just me, but my householders, my partner, it was very helpful for us to all have this knowledge. And the more I've learned about hormones, the more I've also been like, oh, we need to learn more about menopause, because it is so clear that there's hormonal issues that are showing up. You can see it physiologically, emotionally, energetically, burnout, all of that stuff. When we talk about like men's loneliness and depression spikes later on, it's like, it's the hormones, right? So yeah, this is like such good critical information. So for listeners who are like now realizing they're probably in the perimenopausal transition, maybe they've been for a while, but they and their medical, providers have missed it. What would you recommend people do as a first step to prioritizing their care?
Well, first, you should just offer yourself tons of compassion and validation, because you have probably known for a while that something hasn't been quite right. And you are right. Something is changing and you're feeling different because hormones are changing, most likely. So I think the most important thing you can do is track not only your cycle, but track symptoms as well. And that includes physical and emotional symptoms. So there are some tracking sheets out there. I have a worksheet that maybe I can share with Carmen and we can share with you. And it just has multiple symptoms, not just, symptoms related to your menstrual bleeding. That can be really helpful just to orient when things are shifting.
What do you think of these things you can see on the internet, like the 48 signs of perimenopause or 48 signs of menopause, they usually say? Are those helpful?
I think sometimes, but sometimes, like, I'm very, very happy to see perimenopause and menopause being spoken about in the media. It was as 2 years ago, we just saw nothing, right? Like,
Yeah.
it's a big change in the last couple of years. But I also think like we're maybe going a little bit over. I don't know. I think that it's going to be unique for everybody. It's also going to vary in intensity. I don't know if it's helpful for people to feel like they're going to experience 48 symptoms of menopause. That's a little bit alarmist.
A quarter of people, I mean, this was another statistic we didn't talk about, but essentially the way it breaks down, it's like a quarter of people feel kind of pretty much nothing. A quarter of people are going to have like a few symptoms for a little while. A quarter of people are going to have like, yeah, this is a big 5-year kind of situation. And then like a quarter of people are going to be on the longer, more intense 15-year, 48 plus symptoms. So it's kind of a crapshoot, 25% chance either way of how it's going to go for you. But that means that 3/4 of the people are going to have moderate to kind of not much going on. So yeah, I can see how the 48 signs can be like, okay, that could be a little bit too much, but we'll share your worksheet so people at least do have a sense of it. It could be stuff you haven't thought about, like itchy ears and indigestion, random things like that. Anyway, sorry, carry on.
No, that's great. And then you referenced it earlier. I think making some space somehow, even if it's 10 minutes of space where you can, just kind of orient with yourself and be present in the fullness of life, because you really need more space at this life stage to integrate, to ground, to just sort of figure out what's happening. Prioritizing sleep is really key. Prioritizing nourishment. So, many people at this stage are fasting, which I don't think is super helpful, or they're, focusing on feeding their family members and maybe not getting enough food themselves. So it's amazing how just eating regularly and making sure you're getting enough protein can be so stabilizing, not only to your blood sugar, but to your other hormones as well.
Oh my God, can I just say, this is something I shared every group of like people who menstruate, I'm sharing it, that in the 5 sessions this year, where at the end of the telehealth session, you're like, okay, here are the recommendations of things you can do. Of the 5 times you gave a dietary recommendation, 4 out of 5 times you said protein. Out of the 5 times that you made supplements, some kind of like supplementary kind of like vitamin, mineral, whatever, you made a recommendation, 4 times you said vitamin D. So this is my like kind of hack that I keep, like I have it on Post-its. Prioritize protein, prioritize protein. That's like the kind of number one. It's even, I think, just like a good collapse skill to just like kind of, if you could only focus on one thing, it would be protein. If I can only focus on one supplement, I'm like, okay, it seems like vitamin D, because I'm so bad at taking supplements. That's like one of the reasons I was scared to go to a naturopath. So I was like, they're going to make me buy all these supplements. I'm not going to take them. So yeah, I really appreciated how simple you made it to be like, okay, here's some things you can do dietarily, but like prioritize protein, people. Yeah.
Yes. And most people are deficient. Most people are, entering perimenopause, not even getting close to what they need. And then we actually need a little bit more at this life stage. So yeah, I think probably almost everybody could benefit from increasing their protein. And I wasn't going to mention vitamin D here, but I think it's a good one. So that would be something to for sure look into in terms of some blood work. This is a really good time of life to get a baseline health assessment. And, if you do have a practitioner who has the Menopause Society certification, you're probably going to get a good comprehensive baseline assessment at this stage of life, but you can certainly advocate for that with whoever you're working with. And having your vitamin D levels assessed can be really helpful because many people are really low. And as Carmen said, it impacts multiple aspects of this stage of life. I would also say probably if it's not part of your life already, introducing practices that support your nervous system and help you to regulate. And I think just thinking about that neuroinflammatory response, all of the tools that you share within your community that, are already supporting people on that level, I think would be very, very helpful. And I am a really strong believer in information sort of directly empowering people and also leading to more resilience. So if we don't know what is happening, it's really destabilizing when we kind of have a sense of what's going to happen or what we could expect. It gives us more of a ground and we can be more resilient through this transition. And I think if we can talk about it with one of the reasons I started these groups is because I was sitting here day after day listening to people who all felt like they were alone and going through this because, we don't all meet this stage of life at the same age. And so their peers may not be experiencing symptoms and they didn't feel like they had anyone to talk to, or maybe they were shy about sharing some of the symptoms. And so I do think it helps if you can even talk about it with one person and share the experience of this stage.
Yes, it's been so helpful. Of course, in our telehealth group, I'm sort of the one who's like, I talk about this with everyone. People can't get away from it with me, but it's so true. It's good for me to sit in a group and be like, wow, this is a very isolating experience, or people feel isolated, but I think also we have so much taboo and secrecy and just like patriarchy around anything to do with women's physical bodies. There's so much shame and concealment and just lack of knowledge. And it's very painful to be like, I'm a grown-ass woman. Why don't I know more about what's going on for me, and why don't my care providers either? So
And
this
also what you shared, sorry,
go
about
ahead.
just, letting your partner be involved, right? So you share what's happening because, that's another piece I want to do is I want to hold a group for partners of people navigating this life stage or family members, because it's so destabilizing to the whole family system in a way to not know what's going on. And I think we can help people navigate this better. We can help people support people going through this transition better if we get them involved and informed too.
Oh my gosh, 1,000%. Actually, were you sharing this? Oh, okay. I was reading this somewhere maybe, or was in one of the classes where it was like back in the day, men wanted to know about this transition because they wanted to be able to go back to their old submissive wife. Like she's no fun anymore. And so these days, hopefully, we can have like a more enlightened approach where it's like, so there are environmental factors that exacerbate this. And that kind of patriarchal attitude of like, you're no fun anymore is part of it. And so let's get educated about how this is like a whole systemic kind of approach. And also, I imagine they'll do the same thing. The male partners, I'm sitting here thinking about my husband the whole time and being like, oh, okay, so that's what testosterone controls. I don't remember this from like grade 10 bio or whatever, whenever I learned it. It's like I'm thinking about how I'm tracking my partner, and I know he would want to know what's going on for me. I bet he'd be curious about what's going on for himself too, So okay, it's very evident. Anyone who listens to this podcast or knows me at all knows that, like, I walk hand in hand with my rage all the time. And so being able to talk about this and like rage about all the things we carry, all the knowledge we carry, the emotional labor we do around health for our whole family, plus we're doing it for ourselves. And it turns out our caregivers don't even freaking know. I mean, nothing gets me so mad. How do you, Kristin, personally cope with your own rage and potentially the grief too that you may have felt, realizing kind of after the fact, like, oh, this is it for me. I'm actually I'm into menopause soon here. And I only just had my second child. How have you coped with the rage and the grief?
Okay, well, I'll start with the grief because I think that that is super valid. It is a natural transition, but it's still worthy of our care and attunement. And, some people, I had really easy cycles. I was very fortunate. So I really felt the loss of that sort of my youth, I think. Um, yeah, so I think how I coped was I tried to figure out what was happening. And once I figured out what was happening, I think, better able to let myself really feel it and experience the emotion. I certainly also feel like it surfaces in my appointments with people in the clinic. Like, I cry with people all the time as they're going through it. And I think that's, a way for us both to be present to the grief of this transition. And, certainly the forest holds a lot for me as well. And then in terms of rage, this is complicated because I think a lot of the rage is really important to attune to. And, when we feel it surfacing, like, what boundary are we, compromising here? What do we need to say that we haven't said? Where have we not taken a stand for what we know to be a need? Or, all of those things are so important. And to get the rage kind of moving to a point where I'm able to express a need, like my shovel in the garden is really helpful. So just that sort of motion in the ground and movement really helps me. And finding a way, I guess, to take action. So to channel the energy into, maybe it's my own communication, or maybe it's sharing with my colleagues or helping, just further support for women. That is a way that I can move that energy, because it's very potent and powerful, right?
Absolutely. And it's been very powerful to learn from you over the course of this year. And I'm so excited. We'll put in the show notes how, people can get on your newsletter. I'll be your hype gal. I'm going to tell them all about your upcoming programs. But for now, I just want to say thank you, Kristin. You've changed my life. It's been so empowering. And as I shared in our last session, I'm so excited for elderhood because finally my exterior will match the cranky old lady inside me that's been there for so long. But I feel fired up about this and about helping women harness the potency of this. I think it's a protective mechanism in society. We protect our youth, we protect the culture, we protect our boundaries. I think we can be very powerful role models, but how would I ever know if I was still caught in the quagmire of all my physical symptoms, if I didn't have a framework of understanding? If you hadn't done all this research, how would I have known? So thank you so much for sharing your knowledge with the world. I'm super excited about the monthly Ask Me Anythings that you will be part of in the Numinous Network. More detail on that in the outro and the show notes, but so grateful for your wisdom.
Thank you, Carmen. I am so grateful to be here, and I'm so grateful for your wisdom and your work in the world as well.
I said it before, I'll say it again. I am quite sure that most people listening to this episode have learned something today. And I think one of the major issues we have in terms of education around the treatment of perimenopausal symptoms has been around outdated information and poorly communicated science with regard to cancer and hormone treatment. So I loved that class in our telehealth group. And the other class I really loved that really stood out to me was about how much work is missed, how much of the labor force is disappeared, and the financial hit we take when we're going through perimenopause. So the political movement to campaign for paid time off for perimenopausal people has caught my attention for sure. I'm looking to politicians to start taking that seriously. And it's going to require a broad-reaching revolutionary spirit and action, probably a general strike. And I actually do believe that people who don't give a fuck anymore about being nice could really push the needle there, and so we should. So just planting that seed for all of us. Before we talk about programming around this, can I just share one little personal anecdote? Just about what it's been like to be on progesterone. And it's not going to be right for everyone. I get it. But for me, I had honestly forgotten what it felt like to wake up so well rested and restored and rejuvenated and revitalized and ready to face the day, And then when I got on the estradiol, it actually is nice to feel amiable again sometimes, I have so much more patience and capacity again and energy. I feel like I felt 6 years ago. I love my new hormones. Thanks, science. Okay, so go to the show notes at numinouspodcast.com for the link to Dr. Kristin's website and sign up for her newsletter. That's how you can get access to all of her offerings and things. Sign up for her newsletter. You can get on her wait list there for her next telehealth group happening in 2024. I think she has a couple of groups happening. That's where you'll also find out about details about who's eligible for that is on her website, or get on her mailing list so you get it in the newsletter. You'll also be the first to know when her self-paced course begins. So go to her website, which you'll find in the show notes, get on her newsletter. The self-paced course is going to have the exact same information as the telehealth group, but just without the medical advice and prescriptions. Then also not medical advice, but supports that we have over in the Numinous Network. We have 2 offerings specifically for folks interested in exploring the midlife transition. So once a month, we host what we call the Perimeno Jam. So it's a jam for people in perimenopause or menopause. It's led by Breda McKibben, who is trained in functional medicine and a variety of embodiment practices, and who has years of experience as a psychoeducator. And then the second monthly event is the one with Dr. Kristin. It's an AMA, an Ask Me Anything. Each Ask Me Anything has a topic of focus. Like the one in November is about genitourinary syndrome of menopause, GSM, which is a condition that affects like 90% of people in perimenopause and beyond. So that's what we're talking about in November, and then we'll vote on what we're going to talk about in January, because we're going to take a break from this programming in December, because each year at that time we focus on the ritual season of Yuletide in the network, but regular programming will resume in January 2024. So just join the Numinous Network for those 2 that support people who are going through this midlife transition. And when you sign up for the network, you get many other monthly offerings that support your health and well-being as well. You can find out more about that at carmenspagnola.com. Okay, listener shout out today. Thank you so much to someone who goes by Ghost, who left a 5-star review on Amazon.com for my book, The Spirited Kitchen. They write, I wanted to find a way to connect with friends around holidays in a way that feels meaningful. This book offers a guide for old and new traditions around the wheel of the year. Carmen has deep experience in both ritual and recipes. She trained at Le Cordon Bleu. I bought copies for all my friends so that we can begin our journey to transform our year into a magical celebration of seasonal ritual and delicious food. Yay! I feel so warm in my heart that you're doing this with friends, and what a great gift. Thank you so much for leaving your review, and thank you for doing that work in your community of spreading rituals and recipes. I love it. Thank you. All right, last thing, friends, the Spirit of Yuletide returns to the Numinous Network starting on December 1st with our class on spiritual hygiene for the holidays. We always start by getting right. We get centered, we get grounded, we connect with our spirit. Then on December 2nd, we have our annual session called Grounding the Season. So in that one, we go a little deeper. We connect with ourselves and our values, and we practice saying no to what we we don't want to do. We say no to what we want to say no to. We practice saying yes only to what we want to say yes to this holiday season. And then we take a look at like some of the rituals and recipes and things we might want to do this year, and we just accept we can't do it all. So we prioritize. Of course, I'm going to do my annual classes on fancy garland and wreath making. I love having that like crafternoon with folks. I'm also going to do forage sweet vermouth for those of us who like cocktails and seasonal tipples and foraging. Plus, this year, I'm adding a sugar cookie decorating class. I'm so excited. And I'm also sharing all the cookie recipes that couldn't fit into the Yuletide chapter of my book. Then also I'm adding a daily 15-minute live stream of altar tending as ritual devotion for the 12 days of Yuletide. It's going to be quiet and gentle and warm and cozy and magical. And the Spirit of Yuletide in the Numinous Network is going to help keep your values and spiritual connection at the center of the season. Simply become a member of the Numinous Network to join us during the holidays. You sign up at carmenspagnola.com. CarmenSpagnola. Until next time, take care.